All right. Thanks, everybody, for joining us today. We are here with the Health Richmond City and Henrico County Health Department, Stephanie Tony, and she is going to be filling us in on what is new and what do we need to know with COVID-19 vaccine. So thanks, Stephanie, for being here.
Thank you so much. It's always a pleasure to join and participate and make sure that we are giving updated information to the team about COVID-19 and where we are with distribution of the vaccine. So we're going to roll through these slides and share a little bit more about what you need to know. So we have a poll here, which I'll kind of breeze through fairly quickly, just because I want to make sure that to our audience, we give space to asking the question to get to know our audience a little bit better. Are you planning on getting the COVID-19? Maybe you've already gotten it. So yes, maybe, but you're here to get more information. So you're kind of on the fence about it. Or maybe the answer is no, not right now. But I'm here because I want to be able to share reliable information with others. So just wanted to make sure that we celebrated, regardless of why you're here, we're glad you're here to get this information and be able to share it with others. And so to the question, if you answered the previous question with no, you're not getting the vaccine right now, we'd love to learn more about some of those reasons. Why? Is it safety? You're concerned about safety or side effects? You're concerned about, you have like a mistrust right now. There's a little bit of disbelief about around the COVID-19 illness. You're just waiting maybe for full FDA approval of the specific type of vaccine you want to get, or you want to wait months or years or something like that. And then maybe there's another reason, and we welcome you providing us with that feedback. The reason we're asking these questions is because it really helps us know the audience or the community or like what's happening, right? And so it just helps us with continued education and support to connect with the community. All right, so worldwide, there's lots of different vaccines in different phases. There are 8 that are approved worldwide. For the purposes of this presentation, where we are now, we're going to be focusing on these 3 vaccines, which are approved within the United States. So that's Pfizer-BioNTech, Moderna, and then Johnson & Johnson. And then recently, Pfizer-BioNTech was able to receive full use authorization in the United States. So how does the vaccine work? That may be one of the questions that you have. So this slide is busy, but what I wanted to focus your attention on are the areas that we outlined in red on the left and on the right. So the Johnson & Johnson vaccine is a viral vector, which means that they place the harmless virus. They use that to be able to deliver the viral genes into the immune system. And then on the left-hand side, they use messenger RNA that sends a message that explains with the RNA to explain to your immune system what to do if it were to see the virus in the future. So regardless of if you get Johnson & Johnson, Moderna, or Pfizer, they all work that it tells your immune system, if you see this virus in the future, fight it off, right? And so how they do that is a little bit different with using messenger RNA or using viral vector. So one good thing you should know about any vaccine that you get, you cannot get the COVID-19 virus from the COVID-19 vaccine. There's no live or inactivated virus within the vaccine themselves. So there's no risk of becoming infected with COVID-19 by receiving the vaccine. So that's super good news, because I know a lot of people are concerned about that, but there's no risk of that. All right, so a couple of more a little bit more information about some of the differences. If you get Pfizer today, 21 days from now, you'll be eligible to receive your second dose of the Pfizer vaccine. And if you get Moderna today, 28 days from now, you'll be eligible to receive your second dose of the vaccine. And then Johnson & Johnson is a 1-dose vaccine. All right, so I know a lot of people are like, well, how do they make these vaccines so quickly? And thankfully, things just didn't start in 2020. There was a lot, 15 years worth of research and groundwork that had been done with messenger RNA vaccines in order to help with the groundwork in order to produce the vaccine. A lot of times the reason a vaccine takes so long to be able to be distributed is usually the money that's associated with, or that the manufacturer will have to raise in order to transition or apply and submit their application to be able to transition from one phase of clinical trials to the next. And so with 4.5 billion federal funding supporting the work of finding a COVID-19 vaccine, they didn't have to take the time that usually they have to take in order to raise funds. And so I mentioned this a little bit about the different phases. So there's phase 1, 2, and 3 of clinical trials in order for certain safety measures to be met, in order for things to continue to move forward in the process. And so, as I was mentioning, to move from phase 1 to phase 2 may take millions of dollars. To move from phase 2 to phase 3 may take another couple of $1 million, right? But with billions of dollars available to support the manufacturers in moving from one phase to the next, no steps were skipped. Went through all the same steps as any vaccine would have to go through, any medication would have to go through in order to get FDA approval. And then here at the end, emergency use authorization is just a rapid authorization process that allows the vaccine to be distributed. But that doesn't mean that any steps were skipped. Still, all of the safety things were adhered to, right? And so super good. All right, so let's talk a little bit about efficacy. How effective are these vaccines? So Pfizer and Moderna are 95% effective, and Johnson & Johnson is 72% effective in preventing you from getting the COVID-19 vaccine. I will say, I probably should have this bottom sentence or phrases bolded, because really what you need to know is that all 3 of these vaccines have shown incredible efficacy. They're very effective in preventing you from having severe illness that makes you have to go to the hospital and get hospitalized, end up in the ICU, and death from COVID-19. So that's the really wonderful news about the vaccines. So I know somebody's like, well, why don't I just get the vaccine? Why don't I just not get the vaccine? And still you want to get it because you want to prevent severe illness. You want to prevent yourself from having to go into the hospital and end up in the ICU. And of course, no one wants to die from COVID-19. So strongly recommending getting the COVID-19 vaccine, super effective. All right, so is the vaccine safe? Absolutely, yes. So I talked about the FDA making sure that all of those safety steps were passed in order to move forward to the next phase of clinical trials. So that's usually phase 1 and phase 2. There was also independent data safety monitoring board that reviewed all of the documentation through the clinical trials to make sure that all of the safety measures were met as well. And then post emergency use authorization, we are inviting anyone that gets the vaccine to register on a site called vSafe through the CDC, so that any symptoms that a person may have after they get the vaccine can be documented through that. So the website will ask, do you have any additional symptoms after you've received the vaccine today, 2 days from now, a week from now, 3 months from now. And so they'll do a good job of requesting that feedback, so that as we're collecting millions of people's data on how they've been feeling after they've received the vaccine, we're able to provide the symptoms that you may experience are mild and temporary, because after hearing from millions of people, we're able to see that information. So that's good news there. All right. So we all know that Johnson & Johnson was on pause in the United States. But after looking at all of the data and all of the information, the FDA and the CDC have full confidence that this vaccine is safe and effective in preventing the COVID-19 virus. So they were able to take it off of pause. And so any potential risk, the benefits actually outweigh those risks for those that are 18 and older. So they were able to remove that pause. So I want to talk a little bit more about the side effects, temporary and mild side effects that someone may experience after they receive the COVID-19 vaccine, which would include soreness and redness around the injection site, fever, chills, fatigue, joint pain, muscle pain, and headaches. And as I read that list, you're kind of like, well, I don't want to experience any of that. Thankfully, I would say to you that they are temporary symptoms that you may experience 24 to 48 hours after you receive the vaccine, as well as mild. So it shouldn't be anything that you are debilitated, that you can't go to work, or that you end up in the hospital because they're so severe. Temporary and mild. So those are the key words there with these side effects that you should note. Also, I would say that all of these are actually good signs, and they show that your immune system is responding appropriately and knows what to do if it were to see COVID-19, the virus, in the future, right? And so it's a good sign that says my immune system's turning on. I have a little bit of a headache. I have some fatigue. I'm feeling tired. I may have a mild fever. So my immune system is reacting in an appropriate way so that in the future, if it were to see the real deal, it would do the same thing to fight off or prevent me from getting COVID-19. So good news there, temporary mild side effects. So that's a major question that most people ask. So who can get the COVID-19 vaccine? I'm not going to spend too much time on several of these slides, but just wanted to make sure that everybody knew that the Advisory Committee on Immunization Practices has some goals to include decreased death and serious illness as much as possible, as well as increase the chance of everyone to enjoy health and well-being. And so there's a phased allocation approach at the beginning of our distribution in order to make sure that those that were at higher risk were able to receive the vaccine sooner than others, right? And so at this point, we're open to the general population. Anybody 12 and older can get a COVID-19 vaccine between the ages of 12 and 17. That would be the Pfizer vaccine. And then anybody 18 and older could get Johnson & Johnson, Pfizer, or Moderna. And so I think on a later slide, I'll talk a little bit more about boosters, but likely we're going to be trying to do the same phased allocation approach with the booster vaccine in order to make sure that those are most vulnerable get the booster vaccine first. All right, so third dose. I know there's some confusion about third dose versus booster. Third dose means that you have something that makes your immune system compromised in that it doesn't respond as well as it should when you receive your first and second dose of the vaccine. So the recommendation is that those that are severely compromised immune system get a third dose. And then that's fully vaccinated, right? And so you can talk to your primary care doctor if you've got a oncologist or if you're seeing someone for infectious disease because you've got HIV, right? Like they would talk to you about, hey, you're significantly compromised with your immune system. So I recommend you get the third dose of the vaccine. So it wouldn't just be like, do I fit into that category? If a doctor hasn't told you that you're likely in that category, likely you are not. So that's the third dose of the vaccine. And so at this point, the FDA has not recommended additional doses for the general public as far as a third dose. But I'll talk a little bit more about boosters in just a little bit. All right, so the Delta vaccine, you all have heard so much about that as well. It's causing more infections, it's spreading faster, it can cause more severe illness. So super yucky. Thankfully, the COVID-19 vaccine is highly effective in preventing severe illness and death. So that's good news. And so the greatest concern is for those that are unvaccinated. I heard a physician share with me that one of the local health systems that 90% of the people that they're seeing in the hospital or in the ICU and passing away from COVID-19 are unvaccinated. And so it's strongly encouraged to get vaccinated to be able to prevent being a part of the unvaccinated category, because that's our greatest concern right now. And so fully vaccinated people that could still get the COVID-19 virus, could still get Delta specifically. However, they appear to be infectious for a shorter period of time. So that's good news there. All right. So for those that are 12 to 17 years old, they can make an appointment or they can walk in to be able to receive their vaccine. And you can go to vax.rchd.com in order to be able to do that. You can also call our call center, which is at 804-205-3501. So a legal parent or guardian or other adult needs to give permission in order to sign off to say, yes, this 12 to 17-year-old is able to get the vaccine. And then anybody over the age of 18 can come to the actual appointment with that person. So let's say, grandmother's the guardian and she signs for the 12-year-old child to get vaccinated. Maybe older sibling who's 18 years older takes that 12-year-old to their appointment, right? So the parent or guardian has signed off to say, I've given permission for this child 12 to 17 years old to get vaccinated. And then someone 18 or older is there with them at their appointment to be able to receive the vaccine. All right. So boosters, I know that's another question that you may have. And so if you have questions, talk to your healthcare provider. RHHD, which is Richmond Henrico Health District, will not require medical records when we're administering the booster, but we will ask for you to review from a list to be able to say you fit into one of these categories. The same for immunocompromised. We'll, read through a list and say, do you fit into one of these categories? But we're not going to ask for verification documentation. So on the right-hand side of this slide, you can see who should be receiving the Pfizer. So you had to have gotten your first and second dose of Pfizer. Right? It's only eligible for those that have gotten the Pfizer vaccine. And so first and second dose of Pfizer, and then 6 months later, you are 65 or older, 18 or older with a medical condition, 18 or older with a higher risk of, being exposed and transmitting based on where you work. You're eligible to receive the vaccine. So hopefully I didn't confuse you there because there was a lot of words here on this bottom right-hand side, but you had to have received the Pfizer vaccine. Check. Had to have been 6 months ago. Check. And then you have to fit in one of these categories as far as 65 and older, medical condition between the ages of, living in a congregate living space. So you can read through those. I encourage you to go to our website to be able to schedule an appointment. The reason an appointment is going to be required for boosters, because we need to make sure that we verify when you got when you were fully vaccinated. So when did you get your second dose of Pfizer? We need to verify that that's 6 months ago. And then we also want to make sure that you got Pfizer. We wouldn't want you to have gotten another vaccine and we're not there. And so make an appointment, go to vax.rchd.com, call our call center at 804-205-3501 to be able to schedule an appointment for your booster vaccine. All right, so moving into what we've done for administering doses. So across the Commonwealth of Virginia, we have given out over 10 million doses of the vaccine. In Richmond and Henrico, over 620,000. And then over 70% of Richmond and Henrico adults have received at least one dose of the vaccine, and over 62% of Richmond and Henrico population are fully vaccinated. So good news there. We're well on our way to being able to protect those that are unvaccinated right now, but we're not there yet. So encouraging you to get your vaccine. So how do you get vaccinated? I've already mentioned this a couple of times, but worth reiterating. If you haven't received any vaccine before, you can just walk up. We have walk-ups available. There's plenty of other places where you can go as well with, local pharmacies where you can get the vaccine. So you can go to vaccines.gov if you're trying to find the place closest to you. If you want a specific type of vaccine, you can be able to search the vaccines.gov website to be able to see, depending on the type of vaccine you want, you can get it. You can go to our website, vax.rchd.com. You can call our call center, right? Anybody age 12 and older, we're giving out the vaccine. So continue, even after you get the vaccine, to wear a mask, whether you've gotten the vaccine or not, wear a mask. If you feel sick, please stay at home. If you aren't feeling well and you're kind of like, well, I don't really have a fever, but you don't feel right, just stay at home. You can seek testing. You can follow up with your doctor's office. We'd rather you be safe than not realize that really it's COVID and you are, transmitting it. You want to wash your hands. We want to make sure that we cover our cough and sneeze, the appropriate respiratory etiquette. We want to continue practicing that. And then anybody over the age of two and older should wear a mask and continue to physically distance indoors and outdoors based on the CDC recommendations. So moving into, I think I've clicked that a little bit too many times, but why should I get the vaccine may still be a question that you're asking yourself, because it's effective. We talked about it being 95% effective for Moderna and Pfizer and 72% effective for Johnson & Johnson, but all three highly effective in preventing you from being admitted to the hospital, ending up in the ICU with severe illness and death from COVID-19. because it's safe. We talked about the mild temporary side effects that you may experience. And so definitely safe because it's free. There's no cost to you. While a provider that's giving you the vaccine may ask for your health insurance information, there's no out-of-pocket cost to you. Because end of the pandemic depends on most of us getting vaccinated. That's going to be important to be able to protect those that are unable to get vaccinated right now, because the rest of us need you to stay as healthy as possible. So you are important and valuable to your family. You're important to your community. You're important to the workforce. And so we want everyone to stay as healthy as possible. That's public health all the way around, right? Because the COVID-19 vaccine fights more than just the virus. So we're dealing with lots of pandemics, right? It feels like there's so many social determinants of health or challenges that we're facing in community and, with public health and health disparities and so many other things that COVID-19 vaccine is helping in a lot of ways as well. So we're fighting more than just this virus with this vaccine. So we want to make sure that we're continuing to give it out with equity. All right. And then Dr. Fauci, I feel like I want to call him uncle because I've seen him so many times on TV and, heard from him and, just sharing transparently about where we are with things and, giving advice and really reminding us of what we need to do to keep ourselves safe, right? But there's this link here that you can watch on YouTube if you want more information there. All right. So as we wrap up, I'd love to hear the same question we asked at the beginning. If you're already vaccinated, you're still already vaccinated, right? But maybe you're still on the fence, you still need more information, or maybe you're still a no, but you're here to get more reliable information, but would love to be able to receive that feedback. And then on this slide, we'd like to know, what did you learn? So one, you didn't learn anything. You've heard all of this before. I did share a couple of, maybe you heard this presentation a couple of months ago, but we've got some new information now about boosters and third doses and things like that. So maybe you're not a one, even though you have heard it before. There were some new things in here that you've learned. And then to the 5, I learned a lot. This was very informative. Maybe you've never heard this presentation before. So would love for you to scale and provide your feedback there on how much you've learned. All right. So as we wrap up, I want to challenge you with 3 things. Find an opportunity to get vaccinated. I want you to encourage and share your experience on social media, not actually showing your vaccination card because it has your name, full name, and date of birth. We don't want to show that information. Keep your private information private, but sharing your experience is going to help others. So while it may not be somebody else is going to get vaccinated just because you did, you sharing transparently, you do have a sphere of influence around you that they're like, oh, okay, I see the experience. I know, this person and they're sharing their experience. I can trust what they're saying, right? And so you want to share reliable information with the community and stay well informed with updates as things evolve and continue, more information becomes available. You want to make sure that you're staying up to date with reliable information. So that's why I say thank you to those that may not be planning on getting vaccinated, but are still here to be able to get reliable information to be able to share it with others. And so then to wrap up with our last slide here, wanted to share that that we have a couple of links that you can go to if you've got more questions about, you want to learn more about the variants, you want to learn more about the ingredients, you want to learn more about boosters, you can see those links there. And the presentation also provides additional information on the right-hand side for reliable resources. Obviously, this is not an exhaustive list, but a couple of websites that you can go to in order to get more information about or stay up to date about information about the vaccine, as well as our statewide call center number if you have questions. I know one question that often I get asked nowadays is, what happens if you've lost your vaccination card? You can call the state website and they can walk you through how you can be able to get that information for yourself. You can get a QR code that someone else can scan if they needed to be able to see, yes, indeed, you're vaccinated. You can take a picture of the information that says, yes, I'm fully vaccinated as of, and it will provide that date. And so if you go to vaccinate.virginia.gov, that website allows you to be able to pull up your information about when you were vaccinated, and you can be able to create that QR code. Or you can call the state call center number at 877-829-4682. And so that concludes my presentation. I'm just going to go back to this slide for just a minute. And if anybody that's on the line, if you've got a question, or maybe you don't necessarily have the question, but you've heard the question asked often, I invite you to ask that question now, and I will do my best to answer. Any questions? You can also put it in the chat if you prefer. All right. So hearing none, I've given like a 10-second pause there. The awkward silence sometimes, longer than 10 seconds, you're like, oh my gosh, did I get disconnected? What's going on? So I am happy to be able to participate and share this information and updates with you all. Thank you so much for tuning in today to be able to see this information. Even if you're watching recording thereafter, feel free to reach out if you've got additional questions. We'll do our best to answer the questions that you have. Thanks so much.